So a question I often get about shoulder rehab is, what exercises do you start with? Where do you start the process of rehabilitating a shoulder that is painful? And I usually start in the same place. The reason why I usually start in the same place is because of what usually goes wrong with a shoulder. Watch my other video about the shoulder intro for more detail on this, but what usually goes wrong with a shoulder is whether this is impingement syndrome, whether it's arthritis, whether it's a rotator cuff problem. What's generally happened is the humeral head, the arm bone, has moved upward too far towards the shoulder blade. The rotator cuff runs in this gap. So when the arm bone gets pushed up, it pinches on that rotator cuff, which is where you get rotator cuff tears. It's also what we call subacromial impingement. It's also where most arthritis in the shoulder happens. So once that has become pushed up this way, no matter what you do with the shoulder, whether you're strengthening the rotator cuff or whether you're, protracting or retracting the scapula, none of that's going to help unless you create humeral head depression, right? You got to pull that shoulder bone, the arm bone, down away from the shoulder blade. So there's two ways you can do this. You can do it actively and passively. But either one, both have to happen in order to cause that to stop and relieve the pain. So the first way I like to do this is passively. And to do this, you have to anchor something down at floor level. I've got two bands anchored underneath the door here. The first one is a simple loop, right? I'm going to loop this 360 degrees around my wrist, right? So that I don't have to hold on to it. It's very important that I don't grip this band with my hand, because that tightens up not just the muscles in my hand, but it tightens up all the muscles in my entire arm, including my shoulder, and it prevents me from getting that humeral head depression because the deltoid is such a strong elevator of the humeral head. So what I'm doing is I'm very gently leaning forward. You'll notice I put my foot here, so I'm not leaning my body weight on my arm. I'm just allowing myself to pull away from this arm and relax the arm, and I feel my arm bone getting pulled down away from my shoulder gently. You don't want to overdo this stretch because you can injure yourself, but you're creating passively that depression of the head of the humerus that relieves the pain on that rotator cuff. It relieves that compression that you experience up in the top of the shoulder. 30 seconds is a good stretch for this, a minute at most. 3 or 4 stretches, maybe once or twice a day, is plenty for this particular stretch. But what you're doing is you're retraining the muscles and the brain to recognize that this is too far up, right? With all of our shoulder pain, we're always up here. You're always getting pain up in the neck and up in the upper traps, up on the top of the shoulders, because this gets overworked and pulls up too far, and the shoulders don't get pulled down far enough. So this is the first way. Wrap this around here. You can also do this with a belt that has a loop in the end, like this. Feed a belt through itself or something and shut it under the door. So with this way, I have an even easier time of relaxing my arm and just gently mobilizing it down away from the shoulder. The other thing that needs to happen, since you're not running around with a strap on your wrist all day, is that you need to teach the muscles in your body to pull downward on that arm bone and maintain that space as you move. The primary muscle that does this is the latissimus dorsi. It attaches at the bottom of the back along the spine. It runs up over the outside of the body and attaches to the arm up here. And that's the primary muscle that depresses that humeral head. So the way to isolate it first is by having someone stretch a TheraBand this way. So you can do this with a cable stack, you can do it with a TheraBand. I'm using a TheraTube. So my arms are straight. I have to have enough tension on this band to pull my shoulders passively up this way. So these muscles, generally people who have shoulder problems can find the upper traps. They can pull this way easily. What they need to learn is how to push the shoulder blades back downward away from the ceiling. So this is upper traps. You're having the band do this, and then you're using the lats to pull the shoulders down and behind. You'll notice my back is arching away from the door a little bit. It's very important not to activate the pectorals and push down this way. Push the chest muscles forward like this. You don't want forward flexion of the spine. If the latissimus dorsi muscles are being activated, the shoulders will depress down and behind you, and you'll feel the muscles down in the lower back here, pulling that shoulder blade down towards your belt. You want enough resistance here, again, that it pulls the arms passively up. You know, for someone who is very weak in this muscle, that much resistance might fatigue them after 3 sets of 10 or so. 3 sets of 10 to 15 repetitions on this per day is usually good, but also you need to remember to maintain that position as you're moving, right? It's not good enough to just do the exercise and then forget about it. You have to remember that I don't want to walk around with my shoulders up here, activating these upward pulling muscles. I want to activate that downward pull all the time so that I'm maintaining that space that I'm learning to do with the exercise. So those are my 2 favorite ways to start the shoulder rehab process. If you don't learn that scapular depression, if you don't learn that motion, you can do a whole lot of things with a shoulder. You can do months and months of rehab and never get rid of that pain, because that's kind of the first thing that has to happen in order for all the other exercises to build on and maintain a healthy and pain-free shoulder motion.